With that, I'll go ahead and introduce our guest speaker. Today we have an assistant professor and member of the graduate faculty in the Department of Animal Science at Texas A&M. He grew up in Shiner, Texas, and received a BS in Animal Science from Texas A&M University. He then received a master's and PhD from the University of Missouri. Prior to returning to Texas A&M, he was on faculty at the University of Tennessee in the Department of Animal Science. Ladies and gentlemen, Dr. Pohler.
All right, thank you for that introduction. Can you hear me okay on that side, Dusty?
I can hear you loud and clear.
All right, excellent. So we'll go ahead and get started. So my goal today is to talk a little bit about, reproductive technology and overall reproductive efficiency in the beef herd. And specifically, I want to talk about it in regards to, let me make sure my screen's working here. I'm going to have to unshare and share again. 1 second. Okay, there we go. So specifically, I want to talk about it in regards to really kind of what we're doing at the Beef Center currently here at Texas A&M, probably as a lot of the Beefmaster breeders that are on here joining today know, is that we are building a Beefmaster herd at the Beef Center. And I thought really one of the things that I would do is just give a brief update where that herd is today, and then talk about the technology that we're using from a reproductive point of view, and highlight some of the reproductive efficiency that goes into that, and currently, what we're doing and some things that you might think about, and then we'll take some time for questions. So currently at the Beef Center, the herd is in the very early stages. We have 15 heifers, 15 donated heifers that have undergone 1 AI, or I think 2 of them still need to get their first time AI. And they are being turned out with a cleanup bowl after that AI. I'll talk a little bit about the protocol that we use to breed those heifers. Last year, and knowing that we were getting ready to start this herd, I had some extra recipients, and we transferred a few embryos last year. So we have 4 ET Beefmaster calves and then 1 weanling heifer that are already on the ground. And in the last year, we have had over 100 embryos donated. We've produced them here with animals or donors that came in and were housed with us for a period of time, either through IVF or multiple follicle ovulation, which I'll talk about. Currently, where we are, we're right in the middle of embryo transfers right now. We've done 40 embryo transfers during April into recipients here at the Beef Center, and we're getting ready for a big fresh transfer next week of fresh IVF embryos. And then we'll have some more frozen conventional and IVF embryos as we move through May. So just to give you an update of kind of what's happening there, if you've seen the updates coming out on our social media or in our newsletter, you'll recognize some of these pictures of some of the heifers that we have at the Beef Center. But it's been a lot of fun to work on generating this herd. And it's not a challenge that we have every day to build a herd from scratch, where I basically just have embryo recipients. So a lot of people have worked really hard on this here at Texas A&M, and specifically a lot of my students and people in my group. So I really appreciate all the help, and we're really proud of where the herd is today. But as you think about breeds like Beefmaster and other Bostonicus breeds, and we start to think about where the cattle are distributed around the world, one of the things I want to point out and highlight is that we're really interested in these tropical, subtropically adapted cattle breeds that can deal with heat tolerance, because about 70% of the cattle around the world are represented in tropical and subtropical environments. And as we look at ways to increase efficiency and really drive overall cattle production, this is something that we're specifically interested here at Texas A&M and specifically focusing on as we look at the Beefmaster breed. Now, one of the big things that we always think about and comes up as we start to get into the breeding season, as we start to think about reproductive management in general, is overall reproductive efficiency. And if you think about when or how reproductive efficiency works, I sort of think about it this way. When we think about the different periods of pregnancy in cattle, there's some periods that are really sort of vulnerable to having a lot of loss and having a lot of reproductive inefficiency or a lot of pregnancy loss. And then there are other areas that they're not so prevalent in. And so I just want to break this down in this graph here and talk about this. So in the first 7 days of the embryo's life, once fertilization has happened, once mating has happened between the bull and the cow, or we've transferred an embryo or whatever it might be, there is loss that occurs in this time point. And I'm going to talk about how much that loss is. But from a real on-farm point of view, this fertilization loss gets lumped into this loss that we characterize in the first 28 days of pregnancy. So out in the field, you know, we can do pregnancy checks as early as day 28, day 29, 30 days of gestation. And we're basically looking at the loss that occurs, or the cows that end up non-pregnant in this first 28 days versus the ones that are pregnant. So we call this early embryonic development or early embryo loss in those first 28 days. And I'm going to show you the numbers behind the data here. And then as we go forward, and this is definitely the greatest period of loss, when you'll see in the slide following this, as we go forward from day 28, which is a time that we can detect pregnancy with ultrasound and visualize a heartbeat, there's another period of loss that happens over about the next 15 to 20 days, and that's the late embryo or late embryonic mortality period. And then as we move away from day 45 toward the end of gestation, pregnancy loss really decreases in our beef herds unless you have some environmental challenge, some disease challenge, something like that would really drive that loss. So we're really looking at these two big time points, the first 28 days and then days 28 to 45 as our periods of loss. And one of the things that I want to highlight on here today is I think as we move into the breeding season every year, we have very high expectations for what we would like to achieve, both maybe out of our AI programs and out of our embryo transfer programs. And I'm in the same boat. I want to get the most that we can and get the highest pregnancy rates that we can in these situations. But I think the other thing that we have to remember is that we have to have realistic expectations. And so one of the things is one of my students, Sydney Reese, has recently put together a really large set of data that has over 50,000 pregnancy diagnosis records in it to really look at what are realistic expectations that we can expect out in the field for both pregnancy loss and pregnancy rate. And so this graph is representing pregnancy loss in the first 28 days of gestation. So I'm going to go up here and talk about these first points, and then we can talk a little bit about what all these numbers mean. But if we look at parity of the animal, and we talk about our heifers, our first calf cows, and then our multiparous cows, you can start to see these dots represent pregnancy loss. So for example, in our heifers, pregnancy loss in the first 28 days is estimated to be right around 45%. So if we want to calculate the pregnancy rate in overall and average in our heifers, and this represents 49 different locations or studies, not 49 heifers. Okay, there's thousands of heifers in this data set. What you can estimate is that on average, our heifers for a single insemination should have about a 55% pregnancy rate. And as we go through here, you can see primiparous cows are our first calf cows. They have a lot higher pregnancy loss in the first 28 days, up to 55%. One thing that I want to point out here is that we know very well is animals that have Bos indicus influenced genetics in them versus Bos taurus influenced genetics tend to have higher pregnancy loss in the first 28 days compared to animals that do not. Now, that's part because of the environment they're in. So I don't think that Bos indicus animals have decreased fertility. Actually, I think it's the opposite, but they're in a lot harsher environment where they're performing. But as we look at breeding method, AI, fixed time AI, embryo transfer, you can see as you get into fixed time AI and embryo transfer, we're seeing a lot higher pregnancy loss in the first 28 days. And so these help us set realistic expectations for what we can expect out of our programs. On the flip side of that, the late embryonic mortality side, you can sort of see the exact same thing. I have all these broken out here. But for example, what I want to point out is in our heifers, okay, we're seeing higher pregnancy loss between 28 and 45 days of gestation in our heifers than any other parity level out there. So those are important things to keep in mind as we go through the breeding season and really having realistic expectations. As you boil all the data down and you look at it all across the world, pregnancy rates to AI, fixed time AI, and embryo transfer very seldom on average break 50%. yet we always want to achieve higher than 50%, we need to have our realistic expectations in line with somewhere around that 50, and I think that's a very achievable number. Now, why does all this matter? Well, when we start to look at our financials behind days of calving and thinking about pregnancy loss, and you look at this very simple table that I've put together here. This is not made by an ag econ person anyway. It's made by me, a reproductive physiologist, where we have days of the calving season. So animals that were conceived and bred by time AI, their calves are going to be born assuming day 0 of the breeding or the calving season, the first day of the calving season. You have animals that are undergoing early pregnancy loss, that first 28 days. Their calves are going to at least be 21 days behind this group that didn't experience pregnancy loss. You have this late embryo loss, which is between 28 and 45 days. Those are going to be at least 60 days behind. And then, of course, we have the cows that never calve, right? So they experienced some loss along the way. They stayed in the calving group, but they never had a calf. Here's the estimated weaning weights based on age times 2 pounds per day. And then you can just plug in some calf value. In this case, I used 140 per pound. And you can start to estimate how much, just by looking at pounds of calf weaned, that you're sacrificing in regards to just thinking about embryonic mortality and pregnancy loss. And the real reason that it hurts the most, and we all know this, is that all these animals cost the same to maintain. So this cow that never provided a live calf for you or never ended up calving costs the same to maintain as this cow that produced a live calf on the first day of the calving season. And so one of the big things that we're interested in and that my group works on is why, when you have a pregnancy, an early pregnancy establishment, why don't those animals go on to give birth to a successful alive offspring, and in some cases they undergo pregnancy loss? Because it's obviously costing us a lot of money. And now when we think about that, and we think about what we're doing at the Beef Center, obviously one of the things that I'm trying to do, and my group is trying to do, is increase the fertility out of those animals, both on the recipient side, the embryo side, and on the Beefmaster side as much as possible. And so when you look at the available estrus synchronization protocols that are in the back of any CIDR catalog or in any popular press catalog that you can find, you can very easily become overwhelmed with the number of estrus synchronization protocols that are out there. And one of the things that I want to point out is that when we start talking about reproductive management, you have to pick a set of protocols and a set of standards that work really well for your operation. It has to be something that fits well within your management, within your operation. It's not that you see what your neighbor's doing and pick the exact same thing they're doing, because that might not work in your situation. And that's the reason there's so many options for estrus synchronization when we talk about beef cattle, because there's so many different variabilities of what people might use. One of the protocols that I want to highlight that's specifically been developed for Bos indicus cattle, and this protocol was developed at Texas A&M by Gary Williams' group down in Beeville, Texas. It's called the Bos indicus PG 5-day CIDR protocol, or also known as the B-Sync protocol. This protocol works really well in Bos indicus and Bos indicus influenced females, where you give a prostaglandin injection on day 0, put a CIDR in for 5 days, another prostaglandin injection when that CIDR comes out at 5 days. And then I'm going to talk about, we've also been putting Estrotec patches on day 5, and then time AI 66 hours later. When you do the time AI, you give a GnRH injection. You can also use this protocol without time AI and simply heat check the animals in AI when they come into heat, if you have smaller groups or you have the management capabilities to do that. Now, one of the things that we've been using in this protocol is Estrotec patches, which are these heat detection or breeding indicator patches that are seen here. And we put these patches on when we pull the CIDR, and we score them based on a 1, 2, 3, or 4 scoring system. We give them a 0 if they lost the patch, but in our case, we're having very few animals that are losing a patch. And we characterize these animals that have low scores, which have very little estrus activity, like this animal right here, all the way on the right up here in the top, this Bos indicus female, as having no estrus or low estrus, low signs of estrus, versus those animals that have a lot of estrus activity. And you can use this, and what the data shows is as you increase the amount of estrus activity, or as you increase those patch scores from patch score 1, 2, 3, and 4, you increase the pregnancy rate that's coming along with that AI or that time AI. And so one of the things I want to point out is, you can use this in your herds, putting an EstroTech patch on, using the BSync protocol, pull the CIDRs, do your time AI. When you're standing behind the cow and you're thinking about the fertility of that animal, one thing to consider is that these animals that have their patch completely rubbed off are going to have increased fertility. Maybe that provides you an opportunity to use sex semen. Maybe that provides you an opportunity to use a more expensive straw of semen, whatever it might be, because the data shows you're going to have increased fertility in those animals. We also have data, although I'm not going to have time to talk about it today, that shows that this carries over to embryo transfer as well as you increase the amount of estrus activity. So that's talking about more on the AI side. The next side I want to talk about is whether you use IVP or in vitro produced embryos, or you talk about using conventionally flushed embryos with superstimulation, etc. We've been using both at the Beef Center to generate the embryos that we want for the Beefmaster herd that we're building. I just want to talk a little bit about some of the advantages and disadvantages behind IVF or in vitro fertilized or in vitro produced embryos. Some of the advantages behind that is we can use young heifers or even pregnant donors, which is not something we can do on the conventional side. These animals can be collected every 14 days. I would recommend that they not be done that frequently, but it is something that we can do specifically in our pregnant donors. More cost effective for donors that don't super ovulate well than with traditional ET. We all know that are doing embryo transfer how much FSH costs today. We can really decrease that cost in an IVF sense. If we're able to collect enough oocytes from a single donor, we can fertilize, multiple donors to a single sire. We can take a donor and split her into 2 separate sire fertilizations. We were just doing this with some donors that we had collected, where we're able to take one donor and fertilize to 2 separate bulls. The ability exists to use sex semen through the technology that's available there to make only female or only male embryos. Now the disadvantages, like everything, it takes money. It also takes a highly skilled individual that really knows what they're doing. There is the idea that there's slightly lower pregnancy rates out there. I have 2 question marks behind this, because I would tell you that we're starting to see the gap close between IVF pregnancy rates and conventional pregnancy rates. And I think that's going to continue to close as we move forward. And there's also bull issues and sire problems. We have issues where certain sires don't work well in IVF. They might work well in conventional and AI, but they don't work well in IVF. So those are things that we have to sort through. Now, OPU and IVF efficiency is also something that needs to be a realistic expectation. From a Bos Taurus point of view, we expect to average about 8 oocytes per collection. In very highly productive Bos Indicus cattle, the average is around 23 viable oocytes per collection, and I've seen that range from 0 to 128 oocytes per collection. Now, it is known that Bos Indicus cattle tend to yield more oocytes in this ovum pickup IVF type strategy than our Bos Taurus females, and that there's definitely data to show that. The embryo production out of our donors, what we'd expect is about 30% production from the number of oocytes that we retrieve. And that's a realistic expectation to keep in mind as you're sort of looking at your numbers and thinking about what's possible. So for example, if you produce 100, or if your donor produces 100 viable oocytes that go into culture, you would hope to expect to get about 30% or 30 embryos back for transfer on day 7. That's sort of a realistic expectation that we keep in mind. Now, the last thing I want to highlight is we do all this work from the embryo side, and we pay very little attention to our recipients. And I only have 1 slide on this, and so I'm indirectly sort of doing the same thing here, but I just have this here because I want to highlight how important it is to have good recipient management. And you know, as you think about your expectations from your embryo program, your recipient expectations have to be very high. So we can't just spend money on our donors, et cetera, and then expect our recipients to perform when they might be in poor body condition score or might not have been provided the adequate nutrition or vaccines, etc. We sort of have to pair those together and match those up in what we're trying to do. And this is a really critical aspect, to remember that about that we need to be paying equal attention to our recipients as we are to our donors and our other animals in our production system. So with that, I had about 20 or 25 minutes. I wanted to open it up for questions and spend as much time on questions as possible. I've already had a few questions emailed in, but I'll give people some time to start dropping some questions in through the Q&A, and we'll try to answer as many as we can.
I am not showing too many questions out there.
Okay, I'll start with some of the questions that I got then, Dusty, on my side.
Perfect.
Okay, so one of the big questions that we get is, I'm just going to back up here in my slide set so I can highlight this, is when you're doing a time AI protocol, and let's say that we're using something like the Indicus PG 5-day CIDR protocol, and you pull the CIDR, we're planning on doing an AI, on day 8 here, but we're starting to see some animals that are showing heat, let's say the day before the AI is going to happen. And the question is, how many of those animals do you get pregnant if you go in and sort of what we call cherry pick them off and breed them a day before? And what I'll tell you is, so if we're going to do a time AI at 8 in the morning, and I've got animals standing in heat, at 5 p.m. the day before, I very seldom would go out and AI those before the time AI the next day. Now, if I have animals that might be showing heat 24 hours earlier than the time AI, and I have the capabilities to pull those animals in and to AI them, a lot of times, we try to do that. Now, and if you look at the pregnancy rates behind those animals as we do that, a lot of times we're very successful in getting them pregnant. And so is it because of the timing and how does all that work out? Well, those animals tend to ovulate, are ovulating just a little bit earlier than the group is that's undergo the time AI. So yeah, if you have the capabilities to do that, that's something that's definitely okay and something that I would recommend. But you're not going to decrease your fertility a whole lot if you don't do it, because in a lot of these cases, these protocols have been really refined in a way to maximize the number of animals that you're getting pregnant to the time AI. And there's some variation in even when those animals ovulate as we look at in regards to these time AIs. So that's a really good question and something that, is kind of on an individual basis on what works well for you. But if you have the capabilities, to pull in a few animals to AI them early is definitely something to think about. So I'm going to start going through and try to answer a few of these questions in regards to the Q&A. So can you discuss mineral supplementation of the recips? Mineral supplementation is a really tricky thing to talk about because there's so much variation out there in mineral programs. And really what my take on it is as we think about managing recipients, it's sort of an overall management aspect. So, the same things that we recommend for our overall cow herd go into managing our recipient program. So a good solid mineral program, good vaccination program, a good sort of post-weaning management of those animals. All those same aspects go into management of our recipients. So what I can tell you is that any mineral program is better than no mineral program. As we start getting into the differences of, different type of mineral programs, there is data that clearly shows advantages of things like complex trace minerals or chelated base minerals as we look at programs to increase success, not only in recipients, but also in donors and in reproductive management in general. So next question, hang on, I'm just trying to make sure that, that I'm getting all these questions. So next question is, what are the best recips to use? This is a really good question. There's been a lot of work done by Dr. Cliff Lamb here, our department head at Texas A&M, when he was at Florida, one of his students, Pedro Fontes, in looking at what is the best recipient to use, where they looked at the aspect of, you know, nutrient restriction to both the donors and to the recipients. And the kind of the recommendation that I'm making today for what are the best recipients is recipients that, one, you know, that you can get in your area, that fit well in your area from an environmental point of view. But the data shows that embryos that have some percentage of Boston-Nicus influence in them tend to do better in nutrient restriction-based situations and are able to have increased fertility and decreased pregnancy loss when they are nutrient restricted. So I tend to like recipients that have some Boston-Nicus influence in them, that are, you know, crossbred recipients that would make really good commercial cows in a commercial sense, is sort of the way that I think about it. The other thing that I would point out is if you have the ability to select recipients that are coming out of a cow herd that might have conceived to AI or time AI, or were bred early in the breeding season, calved early in the calving season, things like that all help with recipient selection. Okay, next question is, how much does microminerals have an effect on oocyte production and conception rates? This is a really good question and something that that my group has worked on in regards to efficiency to IVF. One of the things that we did while I was at University of Tennessee is we looked at the effect of using a normal sulfated mineral program versus having donors on a complex trace mineral program, or in looking at the effects of oocyte quality, IVF production, embryo freezability, etc. And what we found in those studies is that donors that were fed complex trace minerals had increased oocyte recovery and increased oocyte viability, but they also had increased embryo production out of those oocytes. And so because of that, you know, I'm a firm believer that it is having an effect. And, you know, some mineral programs better than none, but as we start to refine our mineral program, it probably makes some sense to move toward more of a complex trace mineral program in those donors and even in our recipients. So next question is, what percentage of embryo loss can you attribute to sort of, you know, normal cattle bumping movement, feeding around the feeding troughs, etc., and how does all that work? You know, one of the things that I want to point out is that there's a misconception out there that handling animals for basic management, such as pregnancy diagnosis, ultrasound, palpation, etc., those can drive pregnancy loss. And in my opinion on that is it actually can't. There's no difference in the normal pregnancy loss that we see in those time periods versus when we do pregnancy checks versus when we don't do pregnancy checks. And, you know, how much does the physical sort of hitting into each of the cows and bumping around the feed troughs, how does that affect it? I think it's very, very little. Now, stress itself can induce pregnancy loss and embryo mortality, and I'll give you an example of that. If you breed cows today and you keep them to about day 15 post-AI, and then you decide you want to haul them from College Station down to the valley, that transportation stress is going to drastically increase pregnancy loss and embryo loss in those animals. So the recommendation is we don't really want to move cows after about day 8 after insemination or a day after embryo transfer, and we would like to not move them until we get them to about day 50 in gestation, day 50 or 60 in gestation, and that way it gets us through all those critical windows of pregnancy loss and sort of helps stabilize where we are. So that's something to keep in mind from the stress point of view. Okay, estrus expression plays a major role in fertility on the ET side. The question is there an advantage on the oocyte or on the recipient side? Some of this data, I also do some dairy work with some of my colleagues at other universities and in South America. So some of this data comes from the dairy side. But estrus is not only critical to the animal we're AIing in a normal sense, or that a bull might be breeding, but it seems that estrus activity and estrus intensity is also important on the donor side. So when donors have increased estrus intensity, they tend to lead to more embryo production. And when recipients have increased estrus intensity or more estrus displayed, that also increases pregnancy rates and decreases pregnancy loss. So estrus itself is really helpful in these advanced reproductive technology programs and really helps increase our fertility and decrease our pregnancy loss. A lot of times I think about increasing fertility by decreasing pregnancy loss. I mean, that's really what we're trying to do, because the fertility in general and the ability to establish a fertilized oocyte and have an embryo present on day 7 is pretty high in our beef animals. And so as we go through, we want to minimize the loss forward from that point. All right, still going through all these questions here. So considering that animals did not show estrus on patches, were less likely to become pregnant, what should I do with those animals? Still breed knowing that they're very likely of not becoming pregnant, etc. So let me flip back to this. This is a very common question I get a lot. Go back to my slides here. So this is a set of data. This slide set has 5,000 animals undergoing time AI. Okay, so we bred them based on time AI. What I would tell you is that in this situation, in this patch score 1 and patch score 2, where they had in this patch score 1 very low estrus expression, we still got 30% of the animals pregnant to time AI. So if you take that into consideration, we've already invested in the protocol. We've already invested in the patch. Most likely, we've already bought the semen. So you're still going to catch 30% of those animals and get them pregnant. If you have some estrus activity as you get into this patch score 2, you're getting into that 50% range. So what I think is a bigger thing to look at is what percentage of your herd is showing up in this patch score 1, patch score of 2. Remember, in animals that don't show estrus in this protocol that I'm showing you here, this B-Sync protocol, we're giving a GnRH injection to these animals at time AI. So just because they don't show estrus doesn't mean that they're not going to ovulate. The GnRH is there to induce ovulation if they have a follicle large enough to ovulate. So I would go ahead and still breed those animals. Now, if you have a straw of semen that's $500 versus a straw of semen that's $5, and a cow comes in that doesn't show estrus, you might be more inclined to use the $5 straw of semen than you would the $500 straw of semen, or sex versus conventional. That would be another way to think about it. Do you use the same fixed time AI protocol in heifers that you use in cows? In this case, for what we're doing at the Beef Center, yes, we are. Now, as you look at the recommendations from the Beef Reproductive Task Force here, there's beef cow protocols, which is the one I'm showing here, and there's beef heifer protocols. Okay, so there's protocols that are recommended more toward heifers. Now, in the case of the Boston Indicus PG 5-day protocol, we have been using this in our heifers at the Beef Center, and in the ones that have reached puberty, this protocol will do very well. Now, if you're concerned about where your animals are from a pubertal point of view, the next best protocol that I like to use in heifers, it takes a lot longer period of time, is this 14-day CIDR PG protocol, which is under this long-term protocol here. So this protocol takes 33 days, but it allows you to manage your heifers. You can give your pre-breeding vaccines up front here when you put the CIDRs in. There's a lot of nice aspects to this protocol as long as you're able to plan far enough out and you know, have enough time to accomplish what you're after in that breeding season. Okay, keep moving forward here on these questions. So considering a healthy herd, what would be the most influential factor responsible for early embryo mortality? And what is the proportion of the problem attributed to the cow or to the embryo? So this question is an ever-changing answer, because we learn more and more as we get into what causes early embryonic mortality. So in a very healthy herd that's well vaccinated, that has very few disease problems, you know, one thing that you can normally assume, as long as it's a closed herd and the testing is happening properly and your neighbor's bull isn't visiting you often, that from a disease point of view, you're probably having very little embryonic mortality that's coming from any disease-related aspect. Now, that's not to say it's going to be zero, but it's going to most likely be very low. I think one of the major factors influencing embryo mortality is on the male side. And this is both true in natural service sires, AI, embryo transfer, every step along the way. One of the things from a reproductive management point of view is we put so much emphasis into the cow. We put so much emphasis into making sure the cow's in good body condition score, that, you know, she's been well vaccinated, that she's well cared for, etc. But on the male side of things, we probably don't spend as much time on that side and thinking about what those causes are. So I always think about it this way. When a cow comes in for her final preg check of a breeding season, or in a keep cold type situation, when the cow ends up open or not pregnant, most likely she's cold, she's sold, and becomes hamburger meat. So the cow gets blamed for poor fertility. But if we used a poor fertility bull to breed her, we had a straw semen that had poor fertility, or the embryo that you put into her, there was a problem on the male side. All those factors attribute back to the bull and have no bearing on the fertility of the cow. And so as we make those type of decisions, I think it's equally important to look at the male side as it is the female side. So when using sex semen, is it suggested to breed later in the AI window? Is this a fact or a myth? There's really good evidence to suggest that this is actually the case, that breeding them a little bit later in the AI window is something that definitely helps increase fertility to sex semen. So kind of, you know, and this is also true. I had the question, someone had emailed me earlier, is what about from a Bos indicus point of view? So Bos indicus cows tend to take a little bit longer to ovulate. This is very well known in Brahman. So delaying AI past the AM/PM rule is something that's probably smart both in a Bos indicus type situation and in a sex semen based situation. Now, if you look at the data on the sex semen side, it's somewhere between 15 and 18 hours instead of the 12-hour rule. But there is definitely some fact to that, and it's not just myth. So what do you think about inserting 2 straws of semen, say 8 hours apart? In a normal AI situation, if you're just AIing cows, that this isn't for embryo transfer, I would say that if you're using conventional semen, this is not something that I would consider. Now, when we breed our donors, and when we're breeding these Beefmaster donors at the Beef Center today, we are using 2 to 3 inseminations for our donors for conventional embryo transfer. And normally what I'm doing is when I see the animal, the donor stand in heat, I breed her with a straw of semen, I breed her then about 8 hours later, and then I breed her about 8 hours later again. So that's the approach we're using. Everybody on the ET side has a little bit different mentality to that, but that's the approach I take. And one of the reasons I take that is because we've already put so much cost into those animals from an FSH point of view that I really want to make sure that fertilization is happening. So when preparing for IVF donor collection, do you recommend a change in nutrients, etc., higher protein, whatever it might be? The main thing that I would tell you is, and have a lot of conversations with donor management facilities about this, is you want to minimize the change. You want to minimize the amount of change that's taking place before and around and after the time of collection. So I would encourage you to have your donors on a good nutrient management program to begin with, and just making sure that they aren't losing a bunch of weight or drastically gaining a bunch of weight. You want to keep them in a positive nutrient level where they're sort of at a balanced level. One thing that tends to happen in our donors, obviously, is they tend to get really fat. And so trying to minimize that from happening, or from them dropping a bunch of weight, is critical. So minimizing change around those periods of collection. I often see people that are managing donors, at their house for collections. Instead of the donors being out grazing, they have them up with some hay in a trap. You've got to ask yourself, is that good quality hay? Is that similar to what they would normally be getting? Because if not, if you're just keeping them up with some poor quality hay to manage them, to give them their shots, I would recommend that it's better to have them turned out grazing and bringing them in every day to get their shots. That's probably a better way to handle it. There's no real reason to increase their protein level a lot, because a lot of times these donors don't have calves on their side. If they do, their nutrient requirements aren't super high. I mean, it's not like we're talking about a lactating dairy cow here. It's a beef cow with most of the time very moderate milk production, and something that we don't need to give her a lot more than what she needs. So with the Boston-Nickus PG 5-day protocol, what drugs are given and given at each step in the protocol, and are these drugs available? So yes, all the drugs that are used in this protocol are readily available. One of the things that I didn't get into in my presentation is there's been this idea of using estradiol on the Boston-Nickus side for synchronization. I just want to point out that is not approved by FDA for use, and using estradiol for reproductive management points of view is against law, so that can't happen. But all of these products are readily available. So if you look here in the Boston-Nickus PG 5-day protocol, PG, CIDRs, and GnRH is what we need. If you go back to the actual protocol sheets themselves, you can go down here to the bottom, and you'll see this little red box for GnRH. We have cistrellin, Factual, Fertigil, Ovicis, Gonadabreed. For the PG, we have Estraplan, Estramate, NSync, Lutalice, Hycon, Prostamate, Syncsure. All those are the products, and then obviously the CIDR is readily available. So yes, these are all products that you can purchase through your veterinarian and are readily available and legal for use in the synchronization protocol. Okay, let me keep sliding down here on these questions. After a cow shows heat, how long can you wait to AI her? If you're traditionally breeding cows based on estrus detection, the normal and the sort of the long-term thought was to breed them based on the AM-PM rule. If I observed a cow in heat in the AM, I bred her in the PM. If I observe her in heat in the PM, I breed her in the AM. And that normally still holds true, except when you get in situations where you might be using sex semen or talking about AIing Brahman cows, etc. Now, if you're talking about a time AI situation and you see a cow show heat and you're wondering how long you can wait, can she wait to the time AI? This is the cutoff that I use. So if we have a time AI starting on a Wednesday at 8 in the morning, what I do is on Tuesday, I'll check those animals about, let's say, right before noon, okay, so maybe 11 a.m. If there's any animals that have shown a lot of heat activity before 11 a.m., I might consider cherry picking those animals and breeding them that night. Anything that shows heat from noon on to the next morning will get the time AI. We'll all get bred at the same time. That's kind of the approach we use, and that seems to work pretty well. But it's amazing how long an animal can go. Now you don't want to be 24 hours out, but the 15 hours plus or minus a few hours is something that we can tolerate. So utilizing a blood sample to verify pregnancy when a recipient that has a calf on the side, can she react positive and in fact not be pregnant? So there's 3 companies that market blood-based pregnancy tests, and this is something that we spend a lot of time working on. That's IDEX Diagnostic, Bioprint, and then CRI offers DG29. Each of those tests and each of those lines of test have recommendations for how long postpartum the cow needs to be in order for her not to react positive and not be pregnant. So in some cases that's 60 days, in other cases that's 90 days. And so what I encourage you to do is follow the recommendations in each of those tests to make sure that you're far enough days postpartum to not have that happen. So if you are very short postpartum, that is something that can definitely happen. If a cow comes in standing heat at 7 a.m. but still standing at noon, when do I AI? I tend to AI based on the first time that I see them come into heat. So if we have an animal that comes in heat at 7 a.m., normally I'd be trying to AI her somewhere between 7 and 10 p.m. that night. If she's going to stay in heat, some animals will stay in heat for up to 8 to 10 hours. So it's not uncommon to see them staying in heat. It's just that you want to try to catch that onset of estrus as that first key point to set your breeding window. So where can we get a copy of the protocols? I'll encourage you to visit the Beef Reproductive Task Force. So if you look at the protocol down here at the bottom, Beef Reproductive Task Force, if you search in Google Beef Reproductive Task Force, it will take you to a couple websites and you can find the protocols there. There's also the opportunity to find them in any sire catalog, AI company catalog. They're usually in the back. And these are updated every year and you can find the new ones. In general, are pregnancy rates increasing with sex semen as the technology improves in the same way we're seeing IVF-ET pregnancy rates increase? It's a really good question, and I would say yes, that there's 2 things that are going into this. One, the technology behind sex semen continues to improve, but also there has been a lot of work done both here at Texas A&M and other universities around the US to set up protocols that work better for sex semen. Just as a very brief example, one of the big projects that myself, Dr. Lamb, and Dr. Cardosa here at Texas A&M have worked on is development of a synchronization protocol in heifers that work really well with sex semen. And there's going to be a lot of data coming out on that, where using a pre-synchronization step with a 7-day protocol really increases pregnancy to sex semen. And so we're continually seeing that window close between sex semen and conventional to the point where, you know, fertility is really getting good with sex semen and sex semen protocols. So a little bit of both there, both on the animal side and the technology side. Just make sure I got all these answered here. Dusty, did I miss any that I...
That looks like all of them that we have received. Would really like to encourage everybody that if you have any further questions afterward, feel free to contact us. We'll put you in contact with the best available resources, and definitely Texas A&M University and AgriLife Extension is a wonderful resource that we should all be using. I believe that's about all that we have coming through.
All right, good deal. I'll just give just a brief wrap up real quick in that, you know, one of the things, again, that I just want to emphasize is just make sure as you develop your reproductive management strategy that you do something that works really well for you and that fits your operation scheme. And so, you know, would we like to do 2 or 3 preg checks per year in our operations, sure. But if you can only get 1 done, that's better than none. And as you think about picking protocols, as you think about doing IVF versus conventional ET, all those are going to be dependent on really what you want in the end result, and having realistic expectations for what you're trying to achieve, and really building it in a way that it works with the overall management scheme that you're after. So unfortunately, the breeding season is something that we have to think about more than once a year. We have to sort of put our feeding program together with that, our calf management program, all together to maximize the reproductive management of our herds. So I appreciate the time today. I appreciate Beefmaster for asking me to do this. And like Dusty said, if anybody has any follow-up questions, they know how to get in contact with me.
Dr. Pohler, thank you very much for your time, and we look forward to working with you in the future.